is the David Goodman Reality and Truth Show. My name is Vanita Lambert, and I want to thank you so much for joining me today. It is always a pleasure to have an audience to talk to, and I know that I have plenty of folks out there listening because they call me, and that's a beautiful thing. So thank you for your support. I really, really appreciate you. Couple things I want to talk about today. And the first one is, I just heard yesterday, and full disclosure on this, because I don't know the exact amount, that there's going to be a substantial increase in the Social Security benefits, which in the state of Connecticut can be a really good thing, but it can also be a detriment to some folks, because if you're on that Medicare savings program, if you're an individual and you live in the state of Connecticut and your gross monthly income is under $2,390, and that has nothing to do with your assets. We're talking whether it's alimony, child support, rents, pensions, everything combined together, your gross monthly income, if it falls under $2,390, as an individual, it's a different amount for couples, you're on Medicare, you qualify for the Medicare Savings Program. So I want to get that out there first. And if your only income is Social Security, or I'm not going to say your only income, but if your Social Security is increased by, say, I heard 10.5%. Do not quote me on that. Full disclaimer, I'm not 100% sure, but that's what I heard for the national average. So if you just made the Medicare Savings Program, say your income was about $50 under, say it was only $2,340, and you just made it by the skin of your teeth, you got in under $50, and you made the Medicare Savings Program, that means that the state of Connecticut is paying for your Part B premium, which is $170.10, okay? It's also paying for your co-pays, your deductibles, and if you're on the Medicare Advantage special plan, a dual plan, then you're getting a ton of other special benefits. So if you get an increase of, say, $100 in your Social Security, and you just made it under that Medicare savings grid threshold by $50, and you get that increase, I just want to, find out how that's going to affect you. And I'm going to find out, so I'll be able to give everybody that information. In most cases, if you got a part-time job and you went over that amount, it would just knock you off of all of those benefits, and you would have to switch over and start paying your Part B, start paying for your deductibles, and start paying for your co-pays. So that's one thing I want to find out about. And unless they increase the amount of the Medicare Savings Program limits. Now, effective March 2022, and it kind of goes, it gets renewed every single March, that amount was raised to $2,390. With this increase in Social Security, I don't know if they're going to raise the limit again, so maybe people will not get knocked off. Maybe it's just a temporary benefit that we're getting, because I think the government is trying to help folks get through the inflation. I mean, the best way they know how without going into a recession. And one way to do that is by giving folks more money. And so that's what they're trying to do. But, I don't think the intent is to give people more money and make them lose additional benefits. So I'm thinking there's going to be some adjustments according to the increases, is my point. But be on the lookout for that. Google everything you can, listen to the news, call the Social Security office, and call when you don't have anything to do, because you're probably going to be on hold for a little while. They're pretty busy over there, and I call all the time, and I know I'm on hold a lot. But I just wanted to put that information out there. And another thing regarding Social Security that's really important, and it's another reason why getting the information from a licensed professional can help you, is I was sitting down with one of my clients, and she's 62, and she's able to get her Social Security, and she wanted to continue working, and she did not understand that if you collect your Social Security benefits early, before your full retirement age of 65, 67, or whatever it is, and you start collecting at 62, you are allowed to do that. You'll get a lesser amount, but if you continue to work, you cannot make over $19,500. If you do make over $19,500, then you're going to have to pay 50% back to the state of Connecticut. So, you need to know when to take your benefits and, when to just let them, wait until your full retirement age. So unless you're going to work part-time, unless you're going to make under $19,500, then that's okay. But if you're going to exceed that amount, you're going to have to pay back 50% of it. So just sit down with a licensed professional and get all the information before you start, make a final decision. And so I wanted to talk about, 4 concerns that may keep people up at night. And the first one is hospital and doctor bills. So that would be the area of Medicare. The second one is running out of money, the cost of nursing home or long-term care, and then, of course, final expenses and premature death. I won't be able to talk about all of them today. Last week, I touched on final expenses and gave you some information about that. This week, I want to talk about Medicare, because Medicare Advantage plans especially, because there's so much misinformation, I believe, that we're getting from the Medicare commercials. I have to chuckle on that, because when I hear the Medicare commercials, I have to put it on mute. I can't listen to the whole thing, because the information that they're giving out does not pertain to everybody. You have to listen to, you have to read the small print. And another thing is, it's an 800 number. If you do call that number and you get the perfect Medicare plan and say something goes wrong, are you going to be able to call that number and that same person is going to answer and help you out? That's another thing that, one of my pet peeves that I have about that. You can get, I'm licensed in the state of Connecticut and North Carolina, so I could call North Carolina and sign someone up on Medicare, but, if I don't give them my cell phone number, they won't be able to call me when they have a problem. And so I pride myself on sitting down with folks. I sit at kitchen tables most of the week and look someone in the eye and have a real conversation, hand them my business card with my cell phone number on it, and provide a free confidential needs analysis on the 4 concerns that you may have. And we focus on one at a time, because it's just overwhelming to talk about all 4 categories at once. So the main concern out there is Medicare. And the reason for that is there's so many moving parts with Medicare. And Medicare is not a cookie cutter. And it's just not, the same for every single person. So I customize the plan. I ask questions. And based on your answers to my questions, I make the appropriate recommendation. Not only do I ask questions, I explain every single part of Medicare. And I call it the ABCDs of Medicare. So I explain to each person, how do you qualify for Medicare? And the way you qualify for Medicare is, there's 2 ways. Actually, there's 3. You can be disabled for 24 months, okay? or you turn 65, or you have ERSD, end-stage renal disease. Those are 3 ways that you can qualify for Medicare. However, you have to work 10 years or 40 quarters in the country to be eligible for Medicare. You cannot, migrate to the U.S. and then work a couple years and become eligible for Medicare because you're 65. The other way that you can become eligible is if you could be the beneficiary of someone who is on Medicare, like a husband, okay? And so by working 10 years or 40 quarters and, anyway, you're paying into the Medicare taxes. It is prepaid, so it's an entitlement. You're entitled to Medicare Part A, and Medicare Part A covers the inpatient hospital portion, okay? There is an annual deductible that comes along with that, but the annual deductible for the Medicare Part A / hospital, inpatient hospital, depends on your co-insurance. And your co-insurance can be a Medicare supplement, or it could be a Medicare Advantage plan. And I know it's a little tough trying to get your head wrapped around this. And this is why it's important to sit down, have someone illustrate it out, explain it to you on a piece of paper so that you can keep it in, understand it, and ask questions. So that's Medicare Part A in a nutshell, okay? And then you have Medicare Part B. Medicare Part B covers your outpatient and medical supplies, your outpatient doctor visits and things like that. Medicare Part B pays for 80% of that. And there is a monthly cost for Medicare Part B. Medicare Part A, there's no cost. You've already prepaid for it. You're entitled to it. But Medicare Part B, there is a cost. And this year, the cost for Medicare Part B is $170.10. And it covers 80% of all your outpatient doctor bills, hospitals, whatever. Okay, and there's also an annual deductible. I think this year it's $181. So now you have to cover, you're responsible for 20%, okay? So Medicare Part A pays your hospital inpatient, and with the deductible, Medicare Part B pays 80% of your outpatient medical supplies, doctor bills, or whatever. Now you're responsible for covering the 20% that's left over. Okay, and then there's 2 ways you could cover that 20%. There's traditional supplement, and that's one way you could go, or you could go Medicare Advantage plan, also known as Medicare Part C, which they're starting to mention a lot more on the commercials, but it's all the same thing. Medicare Advantage is Medicare Part C, and it's managed by private insurance companies. And I'm not going to mention any of the names because there's so many different private insurance companies that manage the Medicare Advantage plans. They have restrictions, okay? Most of them, first we'll start off with the cost. Most of the Medicare Advantage plans are 0 premiums or have a very low cost. Most of them also include a drug prescription plan, which is Medicare Part D, so you don't have to pay anything extra for that. And the actual Part C is your supplement, so it's kind of like a package deal. And the reason I talk about the Medicare Advantage plan is because of the Medicare Savings Program as well. If you're one of those folks that's on the Medicare Savings Program with that gray card, which has a lot of different benefits on it, then you sit down with me, I'm going to recommend that I'm going to recommend a Medicare Advantage plan for you. And the reason is being that the gray card will pay your Part B, pay your deductibles, and pay your co-pays if you're on QMB, the Medicare Savings Program. There's so many different names, so many different acronyms, so I understand how the average person can get confused. So that's why I recommend sit down with somebody that's licensed, go through everything, ask all the questions you want so that it's clear for your understanding. And what's good for you may not work for your husband, may not work for your sister or your friend when they say, oh, Vanita, I have this, I have that. Oh, I get this for free. Oh, I don't. It's all because they may be eligible for, they may be income eligible for the Medicare Savings Program. And there's two levels to that, where, if their income is under a certain level, the state of Connecticut will just pay their Part B, and then they will have to pay deductibles and co-pays. So it's just important to have the plan customized just for your needs. And the way I do that, as I said before, is to ask questions. And based on your answers, you're pretty much telling me what you need. And that's how I make my recommendation. So going back to the two ways to cover the 20%, okay? We covered the one way with Medicare Advantage plan, which is a Part C. It also includes what is also known as Part D, the drug prescription plan. But with the Medicare Advantage plans, there are some restrictions and there are some additional benefits. So some of the restrictions are you have to live in the service area. So you have to live in a certain zip code. If you live in Bridgeport, Bridgeport Hospital may be your choice of hospital. So you have to live in the service area of your doctors, of your hospitals. And then the other restriction is you have to be in a network. Your doctor has to be in the network, okay? And, that's important. So most doctors and hospitals accept Medicare. If they're not accepting Medicare, they're out of the game. They're losing money because there's 10 to 12,000 people in Connecticut alone turning 65 and becoming eligible for Medicare every single month. So just imagine if you're a doctor and you don't accept Medicare clients, how many clients do you think you're going to have? You're going to be losing money. So it's a huge provider network is my point. Most all of the major, Hartford Hospital, Bridgeport Hospital, Yale Hospital, most of them accept all the Medicare plans. So, but you have to check and see which ones they do. I'm not going to say that they definitely accept all, but they accept most. And I know this because I've been doing this for a while. So with the Medicare Advantage plans, there are restrictions. Your doctor has to be in the network, and you got to live in a service area. And that's not too hard because, like I said, there's a lot of providers that's in the network. And then with the Medicare Advantage plan, you get additional benefits that you don't get with regular traditional supplements, which I'm going to go through in a minute. So with the Medicare Advantage plan, it covers all of the benefits of Part A and Part B, and it is Part C because it's like a package deal. If you think of your telephone, cable, and internet, you get everything all wrapped up in one. Most of those plans have some type of dental. They have a vision plan. Most of them have a hearing plan, some type of allowance on hearing aids. They have a free gym membership. I have not seen a Medicare Advantage plan that does not give you a free gym membership because they want to keep you healthy. Let's see, what else do they have? They have over-the-counter products, which means, like CVS, things, non-prescription things like vitamins, cough drops, headaches, like Tylenol, things like that, certain things like that. So anything you walk into a pharmacy that you buy that's not a prescription is kind of considered over the counter. And they also have healthy foods. So these Medicare Advantage plans are really, really awesome. And, to provide all of those additional benefits, in my opinion, I think it's awesome to do that. So, but it would depend on your health, on which plan I recommend, and it would also depend on your income, because I'm going to go through the Medicare supplements now. So, which is the other way to cover the 20% of your Medicare plans. Medicare supplements, there are a lot of different Medicare supplements, and they're also known as a Medigap plan, to confuse you a little bit more. And there are certain ones, so you could select a Plan F that might cover every single thing, cover your doctor visits, your co-pays, your deductibles, everything out of pocket that you may spend, but it could cost you, I don't know, $146, and I'm just picking numbers out of the sky. Don't quote me on any of this, full disclosure. But you're going to pay separately for the supplement plan, is my point. So you will be paying for your Medicare Part B, which is $170.10, and then you would pay another separate bill for your Medicare supplement, which could be Part N, Part F, or whatever, and then you have to pay for your Part D, which is required by the government. If you don't have a Part D, which is a prescription plan, then you'll be penalized for that. So, and in addition to having that Medicare, the Part D plan premium, you'll also have to pay like maybe a copay on the actual medication when you get. So it's a more expensive route. And it kind of, like I said, everything depends on your health needs, and everything depends on your health needs as well as your income. If someone is under that threshold of $23.90, there's no way I'm going to recommend that they go on a supplement plan, because they have the gray card, where the Medicare Savings Program, where it's going to pay for everything for you. So it just wouldn't make sense to do that. And I've seen folks that qualify for the Medicare Savings Program without knowing they qualify, and also struggling to pay for a supplement. It's just so important to get the information. Okay, so if you get the information, and it's free information, it's licensed professional information, that will help you make the right choice or a better choice, okay? Selecting the wrong plan can be just as bad as not having a Medicare plan at all. So we covered the Medicare Part A, B, and the 20% gap. That's a small gap. There are two ways to cover that: traditional Medicare, which can be more expensive because you're going to pay for everything separately. So you have 1, 2, 3 bills. And then, or you can go for the Medicare Advantage, also known as Medicare Part C, which there's no cost to most of the plans. Some of them there are, but it's pretty much up to you. And then they come with all the extra benefits. So that's pretty much the A, B, C, and D's of Medicare in a nutshell, okay? And the things that I talked about covers all of the small gaps. And there are large gaps. The large gaps are long-term care. And we'll get into that another time. But I just wanted to mention about the Social Security, the Medicare Savings Program, the Medicare card, how easy it is to access this information. It really is easy. And then another important thing about Medicare is the enrollment periods. The biggest enrollment period is called your annual enrollment period. So if you're already on Medicare Advantage plan, the plans they start the first of the January 1st to December 31st. And you can renew them during October 15th and December 7th. So that enrollment period is your annual enrollment period. And then there's a second enrollment period, which is called OEP, okay? And that period is called Open Enrollment Period. And that ranges from January 1st to March 31st. That gives you the option, say you made a mistake and you selected the wrong plan. your doctor is not in the network for the plan that you selected. Those 3 months give you the option to switch Medicare Advantage plans only. You cannot go from a supplement to a Medicare Advantage plan during that time. You have to go on to a Medicare Advantage plan during October 15th and December 7th if you're going from a supplement. So a supplement or Medigap plan or whatever. So it is really, really confusing. And I understand how confusing it is as I'm explaining it to you because, you have to, it has to actually affect you. And so when you hear the calls, they may be talking about you and they may not, but they cannot talk about every person on Medicare out there because Medicare is not a cookie cutter. Okay, getting back to the enrollment periods. So we covered AEP, which is the annual enrollment period, and we covered OEP, which is the open enrollment period. Then we have SEP, which is the special enrollment period. The special enrollment period is you're eligible for a special enrollment when you retire, when you lose coverage. Say, for example, you retire in May and you retire from, the federal government or whatever, then that gives you a special enrollment period to secure insurance. And if you're Medicare eligible, that's what you would get at that time. Or if you move, if you're on a Medicare Advantage plan and you move out of the service network, then that will give you, if you move from, Hartford to Stanford, for example, then that will give you a special enrollment period to select another plan because you have to live in the service area for Medicare Advantage. Okay, so there are, with the Medicare supplements, I wanted to mention the Medicare supplements, there are no restrictions. You can go to any doctor in the good old US of A. With the Medicare Advantage plans, there are restrictions. But get the information from a licensed professional that pertains directly to you about Medicare. And we're coming up on that period really soon. Medicare season, I call it, October 15th through December 7th. So I want to thank you very much. I hope this information was helpful to you. I want to thank you for joining me today. And this is the David Goodman Reality and Truth Show. And we're on your side.